This is Brent of the Brookbush Institute, and in this video we're going to go over manipulations or high velocity thrust techniques. I assume that if you're watching this video, you're watching it for educational purposes and that you are a licensed professional with high velocity thrust or manipulation techniques in your scope of practice. If you're not sure, check with your state board. Most physical therapists, chiropractors, and osteopaths, you're in the clear. I believe that ATCs, you can't do manipulations in the United States, although other countries. Again, check your scope. Of course, massage therapists and personal trainers, these are generally not within your scope. Of course, you could continue to watch these videos just for educational purposes, learn a little anatomy, learn a little biomechanics. If you're going to do these techniques, please make sure that you have a good rationale for putting your hands on a patient. This should be based on assessment, and if you're going to assess, I'm hoping that you'll assess, use these interventions, and reassess to ensure that you're getting the result that you're looking for and have good reason to continue using this technique. In this video, we're going to go over the upper cervical spine manipulations. I'm going to have my friend Yvette come out. She's going to help me demonstrate. Now, keep in mind, if I'm doing a manipulation, I'm doing it as part of an integrated intervention routine that's going to include things like soft tissue techniques, an exercise, and of course, follow up with a home exercise program. And I'm basing this on more than just subjective assessment. Although upper cervical spine manipulation, we might be able to think symptoms would be cervical spine or maybe cervicogenic related. We still want to have movement assessment to be able to reassess if we had any effectiveness. We're still going after stiffness in these joints. So don't forget about like your visual range of motion exams with like rotation, flexion, extension, lateral flexion, maybe lateral flexion goniometry. I know your upper cervical segments don't laterally flex much. It doesn't mean that stiffness in the upper cervical spine won't change muscle activity enough to affect lateral flexion goniometry. And then two ranges of motion to think about a little bit are jut or forward head and nod or chin tuck. If somebody can't get to the ends of range of motion for these, right? The very extreme ends of range of motion, they're restricted. That's a good sign that some upper cervical stuff is going on because it's your upper cervical spine that allows you to extend your head as your lower cervical spine is flexing. And then as your lower cervical spine is extending, it's also your upper cervical spine that allows you to tuck your chin. Right? So these two ranges of motion can be very indicative of upper cervical spine restriction outside of just like maybe rotation. Now, before we go into this technique, a teaching tip. If you're new to manipulations, don't start here. Go ahead and go back to our cervical manipulation video. In that video, I go over mid and lower cervical manipulations. Those techniques are much easier for several reasons, including blocking out the lower segments is easier because you have more to grab onto. Finding the lockout position is easier because there's more motion to work with. And then actually getting the manip is a little easier because what you're palpating during that is not so small. I think if you started here, you're going to have a hard time palpating what you need to palpate, moving in the tiny ranges of motion that you need to move, and feeling that lockout position is not the easiest thing in the world on this particular technique. Now, to get into this particular technique, I can tell you that if you're familiar with the cervical manipulation video, we're still using this basic motion, right? So that's lateral flexion away, rotation toward, with a little extension. Some differences. We're going to do a little bit more of a forward head jut. We're also going to do a little bit more of a side glide than just pure lateral flexion. Right? So before we get into the extension thing, we need to come into this forward head position. Before we just laterally flex, we want to side glide as much as we can. Now, other weirdnesses. Rather than being able to use, I made up a word, weirdnesses. All right, second MCP. Rather than being able to use my second MCP to lock out the spinous process and then bend over it to find lock position, I could only do that if I'm C2 and up, right? Because C2 has a spinous process but C1 doesn't. So maybe you want to try second MCP, find the highest spinous process you can, try to get your MCP there, jut, side bend, and then you guys know I use cradle grip on my cervical manipulations. You could use open hand if you want to, but since I use cradle grip on my other manipulations, I tend to like to use it here. Once I get side glide, jut, blocked out for C2, then I could kind of side bend, rotate a little bit, maybe a little traction I find helps, get her all locked up, and then I can do my manip. But here's the tricky part. What if I need to do C1? What if I want to do C1 on the occiput, right? The atlanto-occipital joint, the AO joint. I don't have a spinous process to use my second MCP on. I need something else. And the way to go is to block the transverse process of C1. Now, if you've never palpated the transverse process of C1, it is just underneath the mastoid process. So here's what I'm going to recommend you do. Find your earlobe. Find your mastoid process. Go just underneath your mastoid process. If you don't feel a bump, like a peg, coming at you into your finger, side bend away, and that transverse process should pop right into your finger. All right, once you do that on yourself, try that little trick on hopefully your friend or colleague when you start, not a flared-up patient. I do not recommend practicing these on flared-up patients. All right, so there's her transverse process of C1 right there, transverse process of C1 right there, right underneath each mastoid process. Great. So now I know what they are. What do I do with them? Well, what I'm going to do is if I'm trying to manip this side, I'm actually going to wrap my hand around so I can use a comfortable hand position because I'm usually using that second MCP, but this time I'm going to use my middle finger and I'm going to push it into the back of the transverse process of C1 and push up this way to block out that vertebrae so that when I go to do my manip, this is blocked and I'm twisting on this blocked out vertebrae. All right, so the way that would look, guys, is here. Find my transverse process. I can use both hands. Got it locked in, right? Now, I can use this palm to help control her head a little bit. All right, I can get into my quasi-cradle grip here. Jut, side bend. Good, now I can laterally flex, rotate, extend or flex, and I find a little traction helps a lot. And once I get her all locked up, right, if I feel like she's tense, I'll have her do the breath thing. Breathe in, breathe out, and then rotation is my primary movement, just like that. You guys notice I just tip, right? So I tipped here. I did keep pressure with my forearm against her head, right, so that I got a little bit of lateral flexion too. At the very least, when I rotated, I don't want her coming out of lateral flexion. Show you guys what that looks like on the other side. All right, so I'm going to find her transverse process. And remember, you can use both hands. It's okay. Take your time. Setup is 99% of this. I keep saying 90 in the other videos. I think 99% is where it's at. Because even when I'm watching the videos, I'm like, I spent 15 minutes talking about setup, and the actual manip was nothing. Right? So there's her transverse process. I'm going to make sure my finger's there. Right? I can use this palm still to help control her head a little bit. I'm going to use this kind of quasi-cradle grip here. I'm going to jut a little bit, side glide this way, right? So I'm kind of, you can think of like kind of opening up the joint that you're trying to manip. Side glide, rotate this way, lateral flexion, some extension on this side. I'm just kidding, we're going to save that one for the close-up recap. So there you guys have it, C1, fingertip via transverse process. C2, you can use your second MCP, just like you did on the mid-cervical techniques. The only difference is it's harder to get on that spinous process because it's so close to the occiput, and you have to jut and side glide first to really make this technique work for you. Stay tuned for your close-up recap. For the close-up recap, I'm going to show you the atlanto-occipital joint manipulation. I think you guys have the blocking of C2 with your second MCP down pretty good, but this This ability to block out the C1 transverse process with the middle finger is a little complicated. So my suggestion is use both hands to find first the mastoid process and then the transverse process of C1. And you guys can use a little lateral flexion away to have that poke you right in the finger. And then I'm going to use this finger to get underneath that transverse process so that I can really get underneath it and like block it. Like right now, I can, not that this would be great technique for a mobilization, but I can literally mobilize C1 on her occiput. All right, so if I feel like I got that type of purchase, that's when I'm ready to do this manip. So now I would jut, right? So pull her into a little bit of this forward head position, and I've removed the pillow this time, guys, just to make it a little easier for you to see. I'm now going to side glide towards the camera, right? So towards you guys. All right, and I'm going to try to use open hand technique here so you guys can see the motions that I'm doing. Because if I do cradle grip this close to the camera, I'm going to block everything. But I'm going to keep my finger there, forward, side glide, lateral flexion, rotation, get her all locked up. And then once I know I have her locked up, maybe a little traction, and I can just rotate, and that's the manip. Right? So I'm not quite as good as that open hand technique. For me, it'd be a little bit more comfortable to get in here. Remember, you're only going to go ahead and do your high velocity thrust when you feel a lock. And deep breath. And just like so. All right, so a little scary for a vet there, but no pain, right? All right. So guys, practice that. Remember, you have your fingertips here that you have to block the joint out with. A little bit of forward, a little bit of side glide, and a little bit of traction really helps with this technique, which then you can do your normal kind of cervical manipulation motions. And then I would say the other big difference with this manipulation is it's almost totally rotation for the actual manip. If you have any questions, leave them in the comments box below. A couple of points to recap. Knowing your anatomy and knowing your biomechanics will certainly help you choose the right technique for the right patient. If you're unsure whether manipulations are appropriate due to their higher intensity, it's okay to do mobilizations. Most research points to manipulations being slightly more effective, but mobilizations being very effective. And of course, we have those videos for you if you want to start with those less intense techniques. Make sure that if you are doing any technique that is based on assessment, and of course that you're reassessing, ensuring that the technique is effective for the patient that you're working on. And when it comes to all manual techniques, guys, manipulations, maybe more than any other, look for opportunities to get live education. Although I know videos are convenient and I'm happy to have these up for you guys to watch, it would be so much more helpful to use those videos as a recap of one-on-one attention with somebody who's experienced with manipulation techniques. At the very least, grab a colleague, grab a friend, and start practicing these before you bring them into clinic and start using them on patients and clients. I hope you enjoyed this video. If you have any questions, please leave them in the comments box below.